In this video, we will explore how DocVoice can help you provide high-quality transitional care and get reimbursed for it using the new CMS Transitional Care codes. Before we get too far into the coding, tell me if this sounds like a familiar situation in your medical practice. One of your patients gets admitted to the local hospital for an ailment. After tests are run, medications adjusted, he is nursed back to health and is sent back to follow up with you. At his next clinic visit, he can't remember the exact diagnosis, the test results, or the medications that were changed during his admission. So now you and your staff are left scrambling to get this information, all in the middle of your busy clinic. Wouldn't it be great if you could simply communicate with the admitting physician quickly to exchange a few pieces of important information about your patients? It would be great to just even be notified that your patient is being admitted or discharged. DocVoice can help you do that. CMS recently published 2 new CPT codes to incentivize high-quality transitional care of patients by outpatient providers. These are the 99495 and 99496 codes. The concepts behind these codes are that outpatient providers should contact the patient or the caregiver within 2 business days of discharge. This means that a mechanism needs to exist for the outpatient provider to be promptly notified of discharge. Then, the outpatient provider has 7 to 14 days to see the patient in a face-to-face visit. The 96 code can be billed within 7 days of discharge, while the 95 code can be billed within 14 days of discharge. Regardless, providers cannot bill these codes if they do not know their patient is being discharged. The DocVoice app allows physicians to communicate quickly with each other in small packets of information we call action summaries. These contain the most relevant pieces of data, such as outstanding labs or medication changes that need to be acted upon in a short amount of time. This quick communication gives outpatient providers enough lead time to be notified of a discharge so that they can quickly contact their patient for a prompt follow-up in clinic. This in turn will allow the outpatient provider to be able to bill the new CMS CPT codes depending on how quickly the patient could be seen in clinic post-discharge.